And our third headline, putting off a final decision. A CDC advisory panel wants to review more data before recommending next steps for the Johnson & Johnson vaccine, which is on pause all across the nation. And that is our top story this morning. The nation's top infectious disease expert, Dr. Anthony Fauci, emphasizing here that this is a pause, not a cancellation of the vaccine. So how long will we be waiting for a final decision from this panel? Joe Ripley joining us live from outside the CDC in Atlanta with a closer look.
Hey, good morning, Chiba. We could be waiting as long as 3 weeks to learn the future of the Johnson & Johnson vaccine, though it's more likely this advisory committee on immunization practices calls an emergency meeting here at the CDC within the next 7 to 10 days to learn about the J&J vaccine future. Well, yesterday, no changes were recommended. The panel held off on making any suggestions, saying they needed more data on the rare blood clots that have been found in 6 women who took the single-dose vaccine. Of course, one of those women has died. The committee also shared info about a possible 7th case of the severe and rare blood clots and a possible case in 1 volunteer during vaccine trials. J&J has previously said the trial case was not linked to their vaccine. Earlier this week, the CDC and FDA recommended a pause in administering the Johnson & Johnson vaccine, but health officials are confident the Pfizer and Moderna versions are suitable alternatives.
We have more than enough supply of Pfizer and Moderna vaccines to continue the current pace of vaccinations.
And that current pace stands at about 3.5 million shots a day nationwide. The advisory panel is going to do a little bit more research on the Johnson & Johnson vaccine, see if any more side effects come up. Of course, the future remains in flux for now, but it's a big blow, Sheba, to all those underserved and high-risk populations who relied on that single-dose Johnson & Johnson vaccine.
Yeah, this was supposed to be an easier vaccine for those folks to be able to get with that one shot. Joe Ripley, thank you. Happening today, the state is launching new efforts to get people vaccinated. The Georgia Department of Public Health Director, Georgia Municipal Association, and city leaders coming together this morning to promote their It's Worth a Shot campaign. The goal is to vaccinate as many people as possible over the spring and summer, and they're hoping to push our state to a vaccination rate of about 70 to 80%. Currently, we're only at an 18% vaccination rate. We'll learn much more about the plan at 11 a.m.